And she told me one day that there was a time that she had depression, but she never knew what it was called. According to her, she just noticed that she lost interest in doing things that she loved. When her friends asked her to go out to party, she couldn't go out to party. But she then realized when she spoke to one or two people that she was going through depression. And before she knew she was going through depression, she couldn't speak up because she was scared of what would people say. Hello guys, welcome back to Life Truth channel. You guys are welcome today, and my name is Ruth, as you all know already. We're going to be speaking on a very special topic, mental health problems, but we'll be focusing more on depression. And today I have a very, very good person here with me. I am very honored to have her here on my channel. Her name is Dr. Natia and I.
Hello everyone, my name is Natia Badrija, as Ruth just say, and I'm a clinical psychologist and a psychiatrist, and today we will focus about the mental disorder, which is a depression, and we will describe the symptoms of depression, the treatment options of depressions, and there is a cure of depression, of course, and there is no it is not a big deal to have a depression because there is a way out from depression.
Thank you again for coming. I'm very pleased to have you. I would like to ask you, is there a difference between depression and feeling depressed? Because you can wake up and say you're sad. Does that mean you're depressed?
Of course, there is a difference between the depression and just between the feeling sad. Of course, there is several symptoms that differentiate sadness from the depression. Okay. We are talking now about the major depressive disorder, which is a serious mental illness. And I will tell you the major symptoms of this serious mental illness, which is a depression, to differentiate from just having a sad mood. Okay. The following symptoms should exist to establish the diagnosis of the depression. This is, of course, the sad mood, loss of interest, and loss of pleasure sensations for at least 2 weeks. For at least 2 weeks.
Does it have to be constant?
Yes, and of course these can last more than 2 weeks. At least these symptoms should exist almost every day, during whole day, and at least 2 weeks to establish the diagnosis of the serious mental illness, which is a depression. We call it major depressive disorder in our professional terms. And of course, the depression can last more than 2 weeks, even 1 year. Okay? So just having a sad mood in the morning and then having a happy mood in the evening, it is not a depression. I tell you the several symptoms which differentiate this depression from feeling the depression. These symptoms are increased excessive desire for sleep or lack of sleep, increased appetite and weight gain or decreased appetite and weight loss, loss of energy, feeling weakness during a whole day, poor concentration, poor attention, and poor ability to make decisions. And what is most important, the person who is depressed has a permanent thoughts of suicide. And even there differentiates the person who has a depression from the person who is just feeling sad mood.
So in this situation, now there is things going on in the society, yes, one way or the other, you're waking up to sad news, bad news everywhere. Does that impact depression, or does it mean that whoever had depression before would have it more likely to come back? Mm-hmm. There's episode of it.
Okay, of course, well, it depends on a person, it's very individual. Of course, there might be a genetical predisposition for being depressed, but of course, psychological factors and social factors can trigger the depressive condition of the personality. But mainly, the serious mental illness, which is depression, mainly predisposed from the genetical factors, and of course, then the social factors and environmental factors can trigger the depression. If the person is mentally healthy, he has the healthy coping skills with the stress. So, of course, psychological stressors and environmental stressors influence on everyone, but some of them can become depressed and some of them no.
So in this society now, how can you, if someone comes to you that they are feeling depressed, what are the things that you can advise them to do to have a proper mental health?
Yes, of course. If the person feel depressed, the first we can advise to that person is to speak up, to talk with someone, a trustworthy personality, who the person will trust. Because speaking up itself has a healing properties. When you speak about your problems, the problems are decreasing. So if you can just find some personality you are trusting, and you can just talk to them, just express your inside conflicts or inside worrying feelings. But in case if it is not enough for the personality, then of course there is a professional treatment, and you can find a professional, and the professional will help you with the professional tools. Of course, depression is not the mental disorder which cannot be cured. It can be cured, of course, and we have lots of tools we can use to treat the depression. These are the medications. Besides the medication, we have the psychotherapies. Psychotherapies are talk therapies, so we can use different types of psychotherapy techniques to help people with a depression. And trust me, there is a way out from depression.
Thank you. You guys said there is a way out, there is a cure. It's not just, and it's not something to be ashamed of. I realize, I don't know of now, I want to ask you of now, do you find that in your practice, people still feel ashamed, stigmatized for coming to visit you because they are depressed and they don't want their family members to know about it? Does that still happen now?
Yes, well, still the stigma exists about the mental disorders, but what I want to tell you guys that problems, it's normal for everyone in this life, because life is full of the different situations which might be stressful. So having emotional problems related to the situation is normal for everyone. In our practice, of course, we still have this stigma, and patients are ashamed to come to the doctor to, for example, cope with their problems. But the earlier you come to the professional, the earlier you can just get out from the depression. So I just want to tell you that depression is not a stigma. Depressed can be in a depression. Any person can feel the emotional problems related to the different situations in our life, but it is normal to have emotional problems for a while.
Yeah. Okay. I want you guys to be sure of what she said. It is normal. It's not a big deal. It's normal because we go through ups and downs, especially in our society now, that things are just happening. It's not your fault when you feel depressed. So if you're feeling depressed, look for someone to speak to. Talk to your friends, your family, your brothers, your sister, or someone that you actually trust. And if the person can't handle it, he or she should be able to direct it to someone that can help you to get out of it. But remember, it is normal and it is not your fault that you're depressed. Thank you very much for the stuff you said, and you've told us about the treatments, how the person can cope. Which one of the first things you said is it is normal and they should talk to somebody. Yes. And if they can't get to talk to someone, see a doctor, see a psychologist, see a psychotherapist,
yes.
Someone you can speak to that can help you. And I would like to, we'll soon be over, we'll soon be done, but there are some things I would like to ask you, and those are like myths, like the truth and the facts, the lies and the facts, like myths and facts on depression. So I will say some things and you tell me if they are true or false. Depression isn't real. It is something in your head. It is being lazy. You can snap out of it. Is that true?
No, of course it's not true. Yes.
Yeah. That is very rude. You just don't tell people they should snap out of depression. They didn't put themselves in that situation in the first place. And another one that people say is anyone can get depressed.
Yes, it's true.
Even children get depressed, teenagers get depressed, elderly one get depressed. Depression does not have an age limit, so
Yes.
anyone can get depressed. And some people say if you can't get over depression, you are weak. You're a weak person.
It's not true, because it is not related to the weakness. Depression is not a weakness. Depression is the mental condition, which can happen with anyone, and it is not a weakness.
You guys said that. Depression only happens to you when something bad happens to you. Is that true?
It's partly true, because a stressful situation, as I told you, may trigger the depression, but not always. No, but that's why it's partly true, and depends on the personality, how the personality perceives the situation. For one person, the same situation can be stressful, and for another person, the same situation won't be stressful. So it depends on the personality.
Okay, you guys said that. Depression is just self-pity. Depression is someone just having self-pity for themselves.
Feeling of guiltiness is one of the symptoms of the depression, so it's true, but it is the symptom of the depression. Already depressed person can feel the guiltiness. So self-pityness, it's also a symptom of a depression. So
And another one I would like you to clarify is depression always will get better by itself.
No. Sometimes there is necessary to be involved in the treatment of the depression. Sometimes it can go away itself if the person can have the strong coping skills with the stress. But it happens with a light depression. We call it light depression when the person is not deeply depressed. But if it is a deep depression, then this deep depression needs involvement of the professionals.
Thank you very much for coming. You guys heard what she said. Depression is not your fault. That's what I really want to make you guys know, that depression is not the person's fault. And if you're someone that has a friend or a family that is going through this, and from the symptoms she said already, if you know somebody that is going through all these things, try to talk to them. Try to be someone there. You don't have to say anything. Just listen to them and make yourself available and make yourself a figure that they can trust.
Just support them. Yes. And just send them at least to the supportive groups, because supportive groups are those who can support depressed persons.
So those are the things I would like to say. Thank you guys for watching today, and thank you so much for coming.
Thanks to you for inviting me to this very interesting interview. Thanks a lot.
And I hope she comes back next time, because we'll be discussing more on other mental problems. This depression is not the only mental problem we have. We have anxiety, we have eating disorders, we have post-traumatic disorders. So there are other mental problems out there. But today we only focused on one, which we see that is very big right now in the society. Thank you guys again for watching. And please don't forget to like, share, and subscribe. And if you have a friend that you feel like they are going through something like this and you can't talk to them, you can just share it to them, and maybe it can help them, and one way or the other. Thank you again, and see you guys next time. Bye.
Thank you. Bye-bye.